الله الرحمن الرحيم والصلاة على محمد وآل محمد. اللهم صل على محمد وآل محمد. Our lecture today is a very important lecture. It is a long case. A 70-year-old male with congestive cardiac failure due to ischemic heart disease and diabetes and hypertension present to you in the ER with a nausea, vomiting, loss of appetite, confusion. On examination, the pulse rate is tachycardia, nearly 150, and blood pressure 110/70. ECG show SVT with variable block. What's wrong? This is a typical case of digoxin toxicity. You should ask the patient whether he is taking digoxin or not, especially digoxin with diuretic. Therefore, this is most probably digoxin toxicity. Immediately take sample for digoxin level measurement, and it turned to be a high 3 digoxin level. It was more than 3 microgram per liter, and this is digoxin toxicity. Immediately you should stop digoxin. Immediately you should stop diuretic. We immediately check the serum potassium, and if it is low, correct it. And magnesium, if it is low, correct it. Calcium, if it is low, correct it. Treatment of this digoxin toxicity is by giving antidote, اللي هو digibind, اللي هو they call it digoxin specific antidote antibody fragment. And because we don't know the amount of oxygen being taken, therefore we give this patient a 20 vial in a saline. We give it a drip over half an hour. This is the treatment. This is the treatment by antidote. But if we know the amount of digoxin being taken, as in case of suicide, suppose he was taking 25 tablets of each tablet 250 microgram. Therefore, you should give 10 vials of digibind. If he was taking 50 tablet, you should give him a 20 vial of this digibind, or called digoxin specific antidote antibody fragment. The second question, what are the uses of digoxin? Digoxin uses in congestive cardiac failure, in any failure, actually heart failure, especially with atrial fibrillation and rapid ventricular response, to decrease the response to less than 100. And in AF, also to decrease the rate in congestive cardiac failure, in AF, rapid AF, in congestive cardiac with AF or without AF, digoxin can be given. They found that digoxin, if given to a worsening case of congestive cardiac failure, it decreased the mortality by 25%. Question number 3, which patient is at risk of toxicity? Those at risk of toxicity are elderly people. Then, therefore, you should not use the tablet of 250 microgram per day in elderly. We use 125 microgram of digoxin daily. Second, people liable for toxicity, those on diuretic, loop diuretic especially, causing hypokalemia. Those with hypomagnesemia, those with hypocalcemia, these people, chronic renal failure patient, they are more liable to do what? To have digoxin toxicity. Children, they do have toxicity if you give them high doses. Question number 4, what is the half-life of digoxin? It is 36 hours. It is big half-life, long half-life. Question number 5, how digoxin it work? It blocks the sodium-potassium pump. What is digoxin? Question 6, what is digoxin? Digoxin is a positive inotropic used in heart failure with AF, used in heart failure without AF, and sinus rhythm, and use it with rapid AF. Question number 7, any patient on digoxin, we should do a plasma level. Why? Because of a narrow between the therapeutic effect of digoxin and toxicity in narrow space. Therefore, to avoid toxicity, we should measure the plasma level of digoxin, as in this patient. And digoxin, you send this to the lab. Those blood taken for digoxin level should be 6 hours after the last dose, and be sent to the lab. It takes 4 to 6 hours to complete the study of the lab in the lab for the level of digoxin. Therefore, you should give digoxin always at night before sleep, because if you want to take a serum level, you should take it at the early morning at 7 or 8 o'clock in the morning and send it to the lab, and because it takes 4 hours to 6 hours to get a result. Therefore, digoxin should not be given at the daytime, should be given at night. How we start in patient needing digoxin? We give 2 tablets of 250 microgram, and after 12 hours we give another 2 tablets of 250 microgram. Then after 24 hours we give him single tablet of 250 microgram. If the patient is elderly, you give 125 microgram per day. But if you give half of this 125, it doesn't work. 62.5, it doesn't work. Question number 9, digoxin, patient on digoxin, and he need to do a DC for arrhythmia. How you do a DC? You should start with small joules. You give 5 joules and you build it up until you get a response. Question number 10, what is the toxic level of digoxin in the serum? Digoxin toxicity starting at the level more than 1.5 microgram per liter, and at the level of more than 3 microgram per liter, toxicity is usually happened. Question number 11, what are the side effects of digoxin? Side effects of digoxin, those extracardiac and those in the cardiac. Extracardiac, nausea, vomiting, loss of appetite, yellow vision, confusion, gynecomastia. While in cardiac, arrhythmia from extrasystole to ventricular fibrillation, bradycardia, multiple ventricular ectopics, ventricular bigeminy, ventricular tachycardia, ventricular fibrillation, alternative between SVT with variable block, as in this patient, alternative right bundle branch block, and then after that you get a left bundle branch block, and bidirectional ventricular tachycardia. All these tachycardia can cause by digoxin. Important question, what arrhythmia is specific for digoxin? R3. SVT with variable block is specific for digoxin. alternative between right bundle branch block and then after that left bundle branch block is specific for digoxin, and bidirectional ventricular tachycardia is specific for digoxin. هذه تنحفظ حفظ زين. From which tree in Europe digoxin been taken? European foxglove. الشجرة تسمى الtree European foxglove. Question number 14. What are the contraindications of digoxin? Hockham and Wolff-White Parkinson syndrome is contraindicated to give digoxin. Question number 15. What are the therapeutic level of digoxin in the ECG? You get ST depression and inverted T in V5 and V6. And there is a reverse tick. This is a tick and reverse tick in this way. This is reverse tick of ST depression. What is the clinical effect of digoxin? Is bradycardia or decreased ventricular rate. This is the clinical. While the therapeutic level of digoxin on ECG, you mean that patient, he is reaching the therapeutic level, you get ST depression and inverted T within V4 and V6, V5 and V6, and reverse tick of the ST depression. What the clinical effect of digoxin decrease in the ventricular rate? This is not MCQ. Digoxin, number one, digoxin toxicity is more likely to occur in hypokalemia. True. Digoxin toxicity is due to excess dose of taken, as in suicide or a drug interaction. Yes, true. Or renal impairment. The patient got renal impairment and he's taking a high dose and you get toxicity. In the South Africa, they use a special flower called yellow oleander flower as a tea, and this flower is containing digoxin, and they do get toxicity. What is the action of digoxin? Action in digoxin is to slow the conduction at the AV node, control the ventricular tachycardia in rapid atrial fibrillation, especially also working in the AV node. Interrupt SVT in the AV node also. Shortening the refractory period and enhance the excitability and conduction in other part, accessory pathway. Excess, I mean, they increase the conduction at this accessory pathway. They may increase the atrial ectopic and ventricular ectopic, and leading to a more complex atrial and ventricular tachycardia. Question number 19. Digoxin largely excreted in which organ? In the kidney excreted actually. Question number 20. Reduced dose of digoxin in which patient? Give a small dose in elderly, children, and renal impairment. Why we do serum level? To detect toxicity and to detect under treatment. This is a very important lecture. Very, very important lecture. You should know it very, very well. And thank you.